I'm Liz Bernier with HRPA, and this is HR Today. I'm here with Zara Sakeja from Personalized Prescribing, and she's going to tell us a little bit about the evolution of prescriptions. So can you tell us a bit about pharmacogenetics?
Pharmacogenetics. There's a sneaky little co in there.
It's a tough word. Can you tell us what it is and how employers are using it?
Absolutely. So pharmacogenetics is just a fancy word to mean drug compatibility testing based on your DNA. So if you break it down, pharma means drugs, genetics means DNA. So it's really using your DNA, your genetics, to determine what's the best medication for you. Okay. There are lots of companies using pharmacogenetics these days. The insurance industry is starting to kind of catch wind of what this science is all about. And really, it's all about reducing the time it takes to find the right medication. Whether you're a patient, individual, employee, it's all about finding the right dose of the right medication the first time.
Okay, so as an employer-offered benefit, how does it really help on the employer side, reducing absenteeism, increasing productivity? What does it do for the employer that way?
Right, so there's a lot of statistics showing that if you're on the wrong medication, so genetically incompatible medication, you're 3 times more likely to be absent from work and 4 times more likely to go on disability. So there's a big savings to be had with employers using pharmacogenetics to help reduce that absenteeism, reduce that disability number.
Okay, so huge bottom line impacts.
Yes, absolutely.
Okay, so that's what Personalized Prescribing does. You're a Canadian company, and you're one of the first.
We're fully Canadian. We're the only company that provides pharmacogenetic testing as an employee benefit.
Okay.
We also do one-off individual testing for patients that aren't covered by their employer currently, or people that want to be proactive and get an idea of which medications will work for them before they're prescribed a medication. But currently our program P3 is the employee benefit version of pharmacogenetic testing, where for a small fee, employers can cover all their employees and the dependents under the plan, and then anytime somebody is prescribed a medication that we test for, that employee can get tested for free, no questions asked.
Wonderful. Okay, and so you mentioned earlier just the huge impact this can have on mental health concerns, mental health issues, and the huge cohort of employees experiencing that. Can you tell us about the difference that makes?
Absolutely. I think from our experience, the vast majority of patients that come to us are patients who are struggling with mental illness. Typically, I think that's because people who are depressed or have anxiety, there are so many medications on the market, and it can be difficult even for that patient's psychiatrist to find the right medication. So typically they get stuck in kind of this trial and error trap almost of start on one medication, typically need 4 weeks to let that medication build up to the right dose. If it's not working, now another 4 weeks to get that dose out of the system. And then this can go on for months, years. I mean, we've had patients who have come to us who have almost been ready to swear off medications completely. And it's amazing because the report comes back and it shows them, here are all the medications you've tried. Look, they're red on the report. It's very validating as a patient to see, it's not all in my head. And I was feeling these side effects and I told my doctor, but we waited a little bit to see something would happen. It's amazing what we can see with a report that shows this employee or this patient, you're not imagining things. These medications are not working for you, but here are some that are. And even with our own case studies, with our own pilot studies that we've done, 60% of employees who have done our test and have had a prescription change have gone back to work from disability.
Wow.
So it can make a huge impact in the overall wellness of your workforce, but specifically for employees who are struggling with health issues.
Okay. So would it be fair to say from your perspective that this is the future of prescribing, this is where things are going?
Absolutely. I would say it's not only the future of prescribing, it's also, we like to say the future is now, because I think, we're surrounded by so much technology, so many advancements in our world, that amazing improvements in how we live. But it's kind of surprising to see that healthcare hasn't really caught up. And I think this is one thing that is really going to bring our healthcare into the 21st century. And like I said, we like to say the future is now, because it's not a forward thinking, it's not far away from where we are now. This technology is available, it's highly accurate, it's, the impact is there. It's just up to employers to take that chance on like a leading edge innovation and implement it into their workforce.
Okay, great. Well, thank you so much for taking the time to sit down with us, Sarah. We
My
appreciate
pleasure.
it. And this is HR Today. Thanks for watching.